I'm Dr. Sri. I'm a board-certified family medicine sports medicine doctor. In my clinical practice, I take care of a lot of patients with type 2 diabetes mellitus. And I've had several patients from various ethnicities, Hispanic, Afro-American, Caucasian, Indian. They have come off insulin completely for their type 2 diabetes mellitus. Just because my patients have been able to come off insulin for their type 2 diabetes mellitus, does that mean that you can also come off insulin for your type 2 diabetes? We're going to find out the answer in this video. So basically, let us say if you're on insulin for your type 2 diabetes, or let us say if your doctor is telling you to go on insulin, but let us say in the future you want to come off insulin, is it possible? We're going to find out all these things in this video. So without further ado, let's get started. So before we dive into the answer for our question, we need to understand what is type 2 diabetes mellitus. So I'm going to use me as an example to understand about type 2 diabetes mellitus. So my name is Srikanth. I'm 6 feet 1 inches long. My weight is around 174 pounds. My BMI is around 22. My cardio fitness is good for my age. I eat healthy most of the time. For example, this morning I had soaked steel-cut oats with chia seeds, a protein smoothie for a snack, a salad for lunch, nuts for a snack, and for dinner I had minestrone soup with pasta mixed. For exercise, I did some running around 15 minutes, followed by calisthenics. I try to remain physically active throughout the day. So let us assume that I don't have diabetes right now and my A1C is around 5.2. So one day my life changes. I got a job in a research field and I spend most of the time sitting right now. I develop a life stressor and I'm not able to manage the stress well. So that leads to me stopping exercise. My breakfast has changed to more processed foods like cereal or paratha with butter. I'm eating donuts at workplace. My lunch has become more like takeaway food like sandwich with fries. My dinner again is becoming more like a takeaway food like chicken biryani or creamy pasta with chicken. I start drinking alcohol 3 to 4 times a week now. So basically, what is happening inside my body? So before, I was consuming a lot of whole plant-based food, but now I'm consuming a lot of processed food. So think about the donuts, basically sugar plus unhealthy fats. Think about the chicken biryani. The chicken biryani is basically made up of rice, so basically pure carbs, no fiber, protein, and when I'm buying it from outside, it's going to be loaded with a lot of unhealthy fats. Think about the pasta with chicken. Same thing. Pasta could be a refined carbohydrate. Chicken, protein, that's fine. But then what is the sauce that I'm going to usually buy? It's going to be either a creamy chicken pasta, so it's going to be Alfredo, which is going to be loaded with butter, cream, and basically oil, right? So all these things, right? So all the foods that I'm consuming, again, they can be consumed in moderation as a part of a normal diet. But when I start to stick with those foods as my primary food choices, I'm consuming a lot of sugar, I'm consuming a lot of like unhealthy fats, and that is driving a lot of insulin resistance in my body. So I'm a South Asian, and we know that we have a high incidence of diabetes in South Asian, and we also know that we don't have a lot of subcutaneous fat storage, so which means that the excess calories that I'm going to consume are basically going to get deposited in the organs or outside the organs. So for example, the foods that I'm consuming right now, the excess calories are going to be used up by muscles, and once my muscle storage becomes completely full, then it starts to trickle down in the liver, and once I start to deposit fat in the liver, and then I develop what I call as a fatty liver. So the fatty liver is going to cause more insulin resistance, and the excess fat is going to trickle on the blood vessels of the heart and thereby increase the risk for heart disease. The excess fat is going to trickle into the pancreas, and we know that the beta cells of the pancreas, that's the one that produces insulin, the fat gets clogged in those beta cells of the pancreas, and thereby the insulin is not going to be produced properly. So now, imagine now I've got insulin resistance, so my body needs more insulin to decrease the blood sugar, but because my pancreas is unable to function properly, then eventually I'm going to start developing diabetes. So in 1 year mark, things change. So my waist circumference have increased. My BMI has not gone much up. So my BMI is still around like 24, 25. So in the definition of obesity, I might still consider as just overweight, but again, since I'm an Asian, this would be considered as obese. And I'm becoming insulin resistant, and my A1C have gone up, which is basically the average blood sugar for 3 months. And let us say my A1C was 5.2, and now my average blood sugar is around like 7 right now. So basically now I go to the doctor, and my doctor states that I'm a diabetic. So he starts me on 2 medications called as the metformin and the glimepiride. Metformin helps with insulin resistance. Glimepiride helps to squeeze the pancreas to produce more insulin and thereby to help with the overcoming the insulin resistance, right? And after that, my waist circumference had gone up. It's gone from 34 inches to 36 inches right now. Initially, I was at 31 inches. And my BMI has gone from 25 to 26. So now basically we're going to divide the patient Srikanth into 1 and 2, okay? So Srikanth 1 is going to stick with the same doctor. So basically the doctor states that your A1C is 9.0, which is basically uncontrolled blood sugar. So we're going to start you on insulin. So Srikanth is currently taking around 50 units a day. He's also taking his metformin regularly. And fortunately, he's able to get his blood sugar under control, but his unhealthy lifestyle continues and he continues to see the doctor. But overall, his quality of life starts to getting worse. He feels like he doesn't have the same energy. And after 8 years, he decides to see Dr. John, which apparently in the community, Dr. John has a more like a holistic health practice. And let us say Srikanth 2 decides, you know what, I'm not going to stick with the same doctor. I'm going to go see Dr. John right away. But the only difference is that Srikanth 1 is seeing John after 8 years, whereas Srikanth 2 is seeing John after 1 year of his diabetes diagnosis. Dr. John talks about, you know what, your type 2 diabetes is due to insulin resistance. It is not a disease. It's just that basically because of your unhealthy lifestyle, you develop type 2 diabetes. So basically the way in is the way out. And we all know that Srikanth, when he started, he had a good cardio fitness. He was eating healthy. He was exercising regularly. So the goal is to create the same healthy lifestyle. So Dr. John helps Srikanth to create the same healthy lifestyle. So Srikanth 2, who actually saw Dr. John after 1 year of diabetes diagnosis, they start to realize that he's making progress quickly. His A1C is getting better. So because his A1C was 9.0, Dr. John still started him on insulin just because of the fact that his A1C was really high. But then as he started him on insulin, his blood sugars got better. But once he started creating healthy lifestyle, Dr. John was able to decrease his insulin from almost like 40 units to almost like slowly like 30 units, 20 units, 10 units. And now Srikanth 2, basically the one who saw Dr. John after 1 year of diabetes diagnosis, he's currently not on any insulin treatment at all. So basically his waist circumference reduced, his fat in the pancreas reduced, his fat in the liver reduced, his cardio fitness improved. Now Srikanth 1, who basically saw Dr. John after 8 years of diabetes diagnosis, again his cardio fitness improved, his healthy lifestyle started to get better, his fat in the liver went away, his fat in the pancreas went away. But Srikanth 1 is not able to come off his insulin completely, but still he has dropped his insulin requirement from 40 units all the way up to 10 units right now. And he's still struggling to come off insulin completely. Why did this happen? So studies show that when your duration of diabetes has been for quite a long time, the probability of type 2 diabetes remission goes down. So some studies show that there's almost a 50 to 60% chance of remission of diabetes once you start lifestyle changes right away. So for example, Srikanth 2 started his lifestyle changes right away, and his pancreas was still able to regenerate quickly, and thereby he was able to get a remission of diabetes. But unfortunately, Srikanth 1, who has had 8 years of unhealthy lifestyle, 8 years of diabetes diagnosis, his beta cells of pancreas is not able to regenerate at the same level as Srikanth 2, and thereby he's still requiring some amount of insulin right now. So basically studies show that, let's say your duration of diabetes is around like 8 years or so, the probability of diabetes remission is almost around like 20%, compared to almost 50 to 60% if your diabetes duration is around like 1 to 2 years or so. That doesn't mean that the person will not go into diabetes remission. Again, these are all short term, right? So let us say if Srikanth 1, who has had 8 years of diagnosis of diabetes, if he continues with a healthy lifestyle, maybe after 1 to 2 years or so, he might be able to come off insulin. But you will see a drastic improvement in Srikanth 2 because he changes lifestyle quickly. But remember, the goal is not to just come off the insulin at all. That's not just the only goal. The goal is to make sure that we decrease the risk for heart disease, because the biggest killer in type 2 diabetes is heart disease. The biggest killer in fatty liver is heart disease. So the goal is to improve our cardio fitness, decrease the fat in the organs, so basically the liver, the pancreas and stuff, and thereby decrease the risk for heart disease and thereby decrease the overall mortality risk. So basically both Srikanth 1 and Srikanth 2 have done really well with healthy lifestyle, except that Srikanth 1 still remains on insulin, but we never know whether he can come off insulin or not. So how this answers your question, right? So if you have been a diabetic for many years, the chances are you may or may not be able to come off insulin, but remember, a healthy lifestyle will still help you in the long run. Again, for people who have been recently diagnosed with diabetes, remember the clock is ticking. Don't wait for the perfect timing to start your transformation. Start today, okay? So briefly, I want to touch on people with type 1 diabetes or maturity onset diabetes of young who are on insulin treatment. Remember, a type 1 diabetic or maturity onset diabetes of young could be a malfunction of the insulin production. So now, let us say I'm giving you insulin to help with that. But let us say if you continue with the unhealthy lifestyle, you can become a type 1 plus a type 2 diabetic, or you can become a maturity onset diabetes of young plus a type 2 diabetic. So it's important that you also commit to a healthy lifestyle, because the goal is to make sure that you need the least amount of insulin as possible to keep your blood sugars under control. I hope this video is helpful. If you want to know more about how to start exercising as a beginner, check out this video. If you want to know more about how exercise can help with diabetes, then check out this video here. And I'll see you in the next video. Until then, goodbye.